Bismillahirrahmanirrahim. Today the topic of discussion is minerals, the calcium, phosphorus, sodium and potassium under the kind supervision of Professor Dr. Saira Afzal. By the end of this presentation, participants will be able to describe the functions, sources, deficiencies and toxicity of calcium, phosphorus, sodium and potassium. Now, first of all is the classification of the nutrients. Nutrients are broadly classified into macro and micronutrients according to the needs of body. Macronutrients are needed in higher amounts while the macronutrients are needed in low amounts. Macronutrients include carbohydrates, proteins, and lipids, while micronutrients included vitamins, minerals, and other like water, fibers, and antioxidants. Minerals include major minerals and trace minerals. Major minerals are calcium, phosphorus, sodium, potassium, and magnesium, while trace elements are iron, iodine, zinc, copper, cobalt, manganese, selenium, fluoride, chromium, and nickel. Today we will discuss about the major minerals that are the calcium, phosphorus, sodium, and potassium. Now what are the minerals? In the context of nutrition, a mineral is a chemical element required as an essential nutrient by organisms to perform functions necessary for life. Minerals, unlike other nutrients, consist of single atom structures and carry a charge in solution. It is present in organic or inorganic combinations, and it is essential for maintaining the body in a healthy state, and it do not give energy or calorie values, and it help other functions in the body. Body needs small but continuous intake of these minerals. If metabolic needs of these minerals are not met, deficiencies occurring causing symptoms may occur. They are not destroyed during cooking. Nutrient minerals, being elements, cannot be synthesized biochemically by living organisms. Most of the minerals in a human diet come from eating plants and animals or from drinking water. However, the four major structural elements in the human body by weight, like oxygen, hydrogen, carbon, and nitrogen, are usually not included in the list of major nutrient minerals because these four elements compose about 96% of the weight of the human body and the major minerals like macrominerals and microminerals, also called the trace elements, compose the remainder of the 4% of the nutrients. This is the periodic table, and in this periodic table, the different elements are shown. These are the elements in the dark green color are the four basic organic elements like hydrogen, carbon, nitrogen, and oxygen, while those in the green color like sodium, potassium, magnesium, calcium, and phosphorus are the quality elements, are the macro elements, while the trace elements are in the light green color, that are the manganese, iron, cobalt, copper, zinc, and selenium. Now first of all we will discuss about the calcium. Calcium is the most abundant mineral in the human body, making up 1.5 to 2% of the total body weight, and approximately 1200 grams of calcium are present in the body of an adult human. More than 99% of that amount is found in the bones, and remaining 1% is found in the blood, muscle, and other tissues. Calcium in blood is about 12 milligrams per deciliter. All living animals possess a powerful mechanism both to conserve calcium and to maintain constant cellular and extracellular concentration. These functions are so vital to survival during severe dietary deficiency or abnormal losses of calcium from the body. They can demineralize bone to prevent even minor losses of hypocalcemia. Thus, bone acts as a vital physiological tissue, providing a readily available source of calcium for maintenance of normal plasma calcium levels. Now, the calcium metabolism, the interplay of the calcium parathyroid hormone and calcitonin. In order to perform vital daily functions, the body works to keep a steady amount of calcium in the blood and tissues. If calcium levels drop too low in the blood, parathyroid hormone will signal the bones to release calcium into the bloodstream, and also may also activate vitamin 2D to improve the absorption of calcium in the intestines, and also signals the kidney to release less calcium in the urine. When the body has enough calcium, a different hormone called calcitonin works to do the opposite. It lowers calcium levels in the blood by stopping the release of calcium from bones and signaling the kidneys to read more of it in the urine. This is the pictorial diagram of the calcium metabolism. The parathyroid hormone in the lower states of calcium will increase its production of parathyroid hormone. The parathyroid hormone acts on kidney, intestine, and bone. On bone, it increases the bone resorption and causes the release of calcium, which in turn raises the serum level of calcium. While only in kidneys, it increases calcium resorption while uh, increase urine excretion of the phosphate. In turn, the calcium serum level is increased. In the intestine, it increases the absorption of calcium. So by these three three functions, it increases the serum level of calcium. Now the functions of the calcium. The main function of the calcium is to form and keep strong bones and teeth. The other functions are helps our nerves carry messages between the brain and the body, helps our muscles contract, supports normal blood circulation, like in coagulation, it has a major role in coagulation and helps our bodies to release hormones. Now how the body gets calcium. The body gets the calcium if it needs in two ways. One is by eating foods or supplements that contain calcium, and the other is by drawing calcium from the body, like the bones. If one does not eat enough calcium containing foods, the body will remove calcium from the bones. Ideally, the calcium that is borrowed from the bones will be replaced at a later point, but this does not always happen, and it can't always be accomplished just by eating more calcium. Now, the recommended amounts of calcium. The recommended dietary allowance of calcium for women is for the ages of 90 to 50 years is 1000 mg per day daily, and for the women of greater than the age of 51 is 1200 mg daily, and for pregnant and lactating women 1200 mg daily, and for the men between the ages of 90 to 70 years 1000 mg daily, and for the men older than 71 years 1200 mg daily. The sources of calcium. The major source of the calcium is from the milk, that is the dairy milk, that may be from the cow, goat, or sheep. 1 liter of the cow's milk contains 1200 milligrams of calcium, while the 1 liter of human milk contains 300 milligrams of calcium. The other sources of calcium are cheese, yogurt, that are the milk products, and others are the calcium fortified orange juice, winter squash, edamame, that is the young green soybeans, tofu, that is made from the calcium and sulfate, canned sardines, salmon fish with bones, almonds, green leafy vegetables like collard, mustard, turnip, kale, bok choy, and spinach. Drinking water can also provide calcium up to 200 milligram per day. These are the different foods that can that can provide calcium. That is the tofu, milk, cheese, almond, edamame, orange, figs, white beans, broccoli, spinach, and tofu and almonds again. On the bioavailability of the calcium. Calcium is a large mineral and not so easy to break down in the gut. The amount of calcium listed on the nutrition facts label of food product is the measure of the calcium in the food, but not necessarily the amount that the body will absorb. Some foods have higher calcium bioavailability than others. Like dairy foods have a bioavailability of about 30% absorption, while the plant foods like leafy green vegetables contain less calcium overall but have a higher bioavailability than dairy. Examples like bok choy has higher bioavailability of 50%, while calcium fortified orange juice and calcium set tofu has the bioavailability of also have a bioavailability of 50%. Almonds have slightly lower bioavailability of calcium of 20%. It means that if we consume 100 grams of bok choy, uh, 50 grams will be absorbed from the gut into the human blood. While if we consume 1000 milligrams of any dairy product, only 30 milligrams will be absorbed from the gut into the human blood. Know the anti-nutrients regarding to the calcium bioavailability. Our downside to some plant foods is that they contain naturally occurring plant substances, sometimes referred to as anti-nutrients. Examples of anti-nutrients are oxalate and phylates that bind to calcium and decrease its bioavailability. Examples like spinach contains most of the calcium of all leafy greens at the rate of 260 milligram um, of per cup cooked, but it also is high in oxalates that lowers its bioavailability to about 5%. It means that if we consume 260 milligram of 1 cup of spinach, it will give only 13 milligram of calcium. So the message is that to do not eat calcium binding foods like spinach at the same meal as calcium rich foods or with calcium supplements. Calcium from cereals. form an insoluble compound with phytic acid, lowering calcium bioavailability. Now the symptoms of the calcium deficiency that may result like chest pain, muscle weakness, muscle cramps, osteoporosis, mostly in post-menopausal movements, fainting and fatigue, cataract, difficulty in swallowing, depression, anxiety, tooth decay, tingling in hands or feet, dry skin, brittle nails, coarse hair, psoriasis, and wheezing. And the causes related to it are calcium deficient diet, age is a cause, like in postmenopausal women, deficiency of vitamin D, phosphorus, and magnesium, medications like diuretics, pregnancy and breastfeeding, kidney disease, thyroid disease, high alcohol consumption, high coffee consumption. But the blood levels of calcium are tightly regulated. Bones will release calcium into the blood if the diet does not provide enough, and no symptoms usually occur. Know the toxicity of the calcium. The upper limit of for calcium is 2500 milligram daily from food and supplements. People over the age of 50 should not take more than 2000 milligram daily, especially from supplement, as this can increase the risk of some conditions like kidney stones, prostate cancer, and constipation. Some research has shown that in certain people, calcium can accumulate in blood vessels with long-term high doses and cause heart problems. Calcium is also a large mineral that can block the absorption of other minerals like iron and zinc. Now, these are the signs and symptoms of the calcium excess or toxicity. These are the indigestion, excessive thirst, bone pain, depression, lethargy, anxiety. Now, we will discuss about the phosphorus. Phosphorus is also a mineral that naturally occurs in many foods and is also available as a supplement. It plays multiple roles in the body, like it is a key element of bones, teeth, and cell membranes. It helps to activate enzymes and keeps blood pH within a normal range. Phosphorus regulates the normal function of nerves and muscles, including the heart, and it is a building block of our genes as it makes up the DNA, RNA, and ATP. That is the body major source of energy. Now, and these are again the functions of the phosphorus in diagram, the diagrammatic form. It helps to form and keep strong bones and teeth. It helps to maintain our energy levels. It forms our genetic material like DNA and RNA. It helps our membranes of our cells, and it keeps the healthy function of our brain and nervous system. And it helps to maintain the normal acid-base balance, and it helps oxygen delivery in the body. Now the phosphorus metabolism. The kidneys, bones, and intestine tightly regulate phosphorus levels in the body. If the diet lacks phosphorus or too little phosphorus is absorbed, several things happen to preserve its stores and try to maintain normal levels. The kidneys excrete less phosphorus in the urine. The digestive tract becomes more efficient at absorbing phosphorus, and the bones release its stores of phosphorus into the blood. The opposite actions may occur if these organs in the body has adequate phosphorus stores. Now this is the metabolism of the phosphate. The increase in the parathyroid hormone release will increase the blood serum level of the phosphate by increasing the bone turnover by releasing the phosphate stores from the bone. While it also has an action on the kidneys, whereby it increases the phosphate excretion from the kidneys in the urine. Now the recommended amounts of phosphorus. The recommended daily amounts of phosphorus for adult male and females for the ages of 19 years and above is 700 milligram daily. For pregnancy and lactation, require the same amount, that is 700 milligram daily. Know the upper limit of phosphorus. The upper limit of phosphorus for adult men and women for the ages of 19 to 70 years is 4000 milligram daily. For older adults greater than the age of 71 years is 3000 milligram daily. Then the upper level for pregnant and lactating women for the ages of 14 to 50 years is 3500 and 4000 mg daily respectively. Now the sources of the phosphorus. The sources are broadly classified into the organic and inorganic sources. Organic sources, a variety of foods naturally contain phosphorus, and the richest sources are dairy, red meat, poultry, seafood, legumes, and nuts. Phosphorus from this food is called organic phosphorus, and 40 to 60% is absorbed in the gut from natural animal and plant foods. The inorganic phosphorus is a process from added to foods to preserve odor, color, and moisture. It is found in fast foods, deli meats, canned and bottled beverages, and many other processed foods. Phosphate additives and preservatives are a significant contributor to phosphorus intakes, comprising up to 30% in the US diet. Inorganic phosphorus is very easily absorbed in the gut, about 90%. These are the sources of phosphorus like meat, fast food, cheese, milk, canned fish, and cola drinks, canned and bottled drinks. So the causes of the phosphorus deficiency. The most common causes of deficiency are kidney problems, hyperparathyroidism, overuse of aluminum containing antacids, and refeeding syndrome. Refeeding syndrome is when a chronic patient has uh, is nil parole for a long period of time. Then when he is starting the parental feeding, then we have then he may have suffered the phosphorus deficiency. Eating highly processed, overcooked, and unhealthy food lead to phosphorus deficiency in the body. Lack of or low levels of phosphorus can bring about the health conditions such as weak and fragile bones. This is more severe in elderly people. General body weakness and fatigue, weak teeth, tooth decay, and gum disease, arthritis, joint pain, and sometimes a stiff neck, rickets. It is possible to suffer from a loss of appetite and become susceptible to become infections. And it is possible to create a diet rich in phosphorus by consuming fresh vegetables and fruits, dairy products, fish, poultry, lean meat, and whole grains are good sources. So we will discuss about the sodium. Salt, also known as sodium chloride, is about 40 to 60%. Contains about 40% sodium and 60% chloride. It flavors food and it is used as a binder and stabilizer. It is also a food preservative as bacteria cannot thrive in the presence of high amount of salt. The human body requires a small amount of sodium to carry numerous sodium-related functions. These functions are helps our cells uptake nutrients and water, helps our muscles contract, helps our nerves carry messages between the brain and the body, balances our body fluids and regulates blood pressure. Now the recommended amounts. For men and women 14 years of age and older and pregnant women, the adequate intake is 1500 milligrams daily. And for chronic disease risk reduction, list 2300 milligrams a day as the maximum amount to consume for chronic disease reduction for men and women for the ages greater than 14 years and also for the older and pregnant women. Now the sources of the sodium. Sodium is not generally a nutrient that you need to look for. It finds you. Almost any unprocessed food like fruits, vegetables, whole grains, nuts, meats, and dairy food is low in sodium. Most of the salt in our diet come from commercially prepared foods, not from salt added cooking at home or even from the salt added at the table before eating. According to the CDC, uh, top 10 sources of sodium in our diets include breads and rolls, pizza, sandwiches, cold cuts, curd meats, soup, murriets, tacos, savory snacks, chips like chip popcorn, pretzels, crackers, chicken, cheese, eggs, and omelette. No sodium and health. In most people, the kidneys have trouble keeping up with excess sodium in the blood. As sodium accumulates, the body holds on to water to dilute the sodium. Increases both the amount of fluid surrounding the cells and the volume of blood in the bloodstream. Increased blood volume means more work for the heart and more pressure on the blood vessels. Over time, the extra work and pressure can stiffen the blood vessels, leading to high blood pressure, heart attack, and stroke. It can also lead to heart failure. There is some evidence that too much salt can damage the heart, aorta, and kidneys without increasing blood pressure, and that it may be bad for bones too. Now, these are the causes of uh, sodium sodium deficiency that may be due to excessive vomiting, diuretic, drinking too much water, excessive diarrhea, heart, kidney, and liver problems, dehydration, inadequate salt intake, or fluid shift from intracellular fluid to extracellular fluid. These are the symptoms of hyponatremia, of the symptoms of low sodium content. These are the and that may be categorized into acute hyponatremia and chronic hyponatremia. Acute hyponatremia symptoms include nausea and vomiting, headache, lethargy, seizures, pulmonary edema, obtundation, and coma, while the chronic hyponatremia symptoms include fatigue, nausea, dizziness, gait disturbance, forgetfulness, and muscle cramps. Now the causes of hyponatremia. These include diuretics, dehydration, diabetes, uh, iatrogenics, diarrhea, and diseases like kidney, sickle cell anemia, etc. Hypernatremia signs and symptoms. These include low-grade fever, flushed skin, restlessness and irritable, increased fluid retention and increased blood pressure, edema that is mostly peripheral and pitting, decreased urinary output and dry mouth. While other symptoms include flushed skin, agitation, low-grade fever and thirst. There is a mnemonic for it that is the fried salt for the hypernatremia symptoms. Now we will discuss the potassium. Potassium is an essential and mineral that is needed by all the tissues in the body. It is sometimes referred to as an electrolyte because it carries a small electric charge that activates various cell and nerve functions. Potassium is found naturally in many foods and as a supplement. Functions of potassium is to help our cells uptake nutrients and water, helps our muscles contract, helps our nerve carry messages between the brain and body, balances our body's fluids and regulates blood pressure, helps our bodies digest foods. The recommended modes of potassium. For women for the ages of 14 to 18 years, the adequate intake is 2300 milligram daily. For women ages greater than 19 years is 2600 mg. And for pregnant and lactating women, the adequate intake ranges from 2500 to 2900 mg depending on age. For men 14 to 18 years of age, adequate intake is 3000 mg. For men for greater than ages of 19 years is 3400 mg daily. The sources of potassium are banana, that is the most richest source of banana, source of potassium. The others are green leafy vegetables like spinach, acorn, squash, yogurt, fish, white beans, baked potato, dried apricots, oranges, tomato, avocados, and mushrooms. So the causes of low potassium levels. These include maybe chronic kidney diseases, diuretics drugs, severe vomiting, excessive sweating, excessive insulin administration, or drugs related to the asthma. Now the symptoms related to the hypokalemia are muscle cramps, weakness, fatigue, constipation, paralysis, respiratory failure, and irregular heartbeat. Now the causes of increased serum potassium, that is hyperkalemia. There is a mnemonic for it, that is machine. Medications like angiotensin converting enzyme inhibitors and NSAIDs, acidosis, both the metabolic and respiratory, cellular destruction like in burns and traumatic injury, hypoaldosteronism and hemolysis, excessive intake of potassium, renal failure, and impaired excretion. The symptoms of hyperkalemia are dyspnea, nausea and vomiting, fatigue and weakness, chest pain, crank muscle paralysis, paresthesia, palpitation, muscle weakness, absent or depressed tendon reflexes. Now the interplay of the potassium and sodium. Potassium and sodium are closely interconnected but have opposite effects in the body. Both are essential nutrients that play key roles in maintaining physiological balance, and both have been linked to the risk of chronic diseases, especially cardiovascular disease. High salt intake increases blood pressure, which can lead to heart disease, while high potassium intake can help relax blood vessels and excess sodium while decreasing blood pressure. Our bodies need far more potassium than sodium each day. Now the turn for the MCQs. First MCQ is calcium is the most abundant mineral in the human body, making up 1.5 to 2% of the total body weight. More than 90% or 99% of the calcium is found in which organ, whether bones, muscles, nerves, blood, and heart tissues.
A.
Yes, more than 99% of the calcium is found in the bones. The body gets the calcium it needs in two ways. One is by eating foods or supplements that contain calcium, and the other way is by drawing from calcium in the body. The richest source for calcium contained foods that can be advised to a person with hypocalcemia is whether egg, milk, fish, spinach, or cereals. Which is the richest source of calcium? Although
B.
yes, the milk is the richest source of calcium. Others are also the sources of calcium, but the richest source is the milk. Which of the following mechanism contributes to a decrease in plasma calcium concentration? Whether the action of vitamin D on the intestine, the action of parathyroid hormone on intestine, or the kidney or the bones, or the action of calcitonin on kidney. Which action will decrease the plasma calcium concentration?
D.
Calcitonin,
D.
calcitonin E, elephant here. The action of calcitonin on kidney will decrease the plasma calcium concentration. Fourth MCQ is a man 40 years of age whose diet is deficient in milk and milk products is taking furosemide for a long period. Recently, he started experiencing muscle weakness and cramps, fatigue, tooth decay, tingling in hands, brittle nails, and dry skin. It is due to deficiency of which nutrient, whether calcium, phosphorus, potassium, sodium, or magnesium?
A. Calcium.
Yes,
A.
calcium is the correct option. As he is not consuming milk, that is the richest source of calcium, and he is also experiencing the symptoms of calcium deficiency. Fifth MCQ is a 50-year-old woman underwent total thyroidectomy for her enlarged goiter. Next day, she started having twitching on her face. This becomes better after giving calcium gluconate. The reason for her problem is due to removal of thyroid gland, removal of parathyroid gland, anesthesia complication, anxiety, or hypothyroidism.
B.
B.
Yes, B is the correct option. As the parathyroid hormone has been removed, so the metabolism of the calcium has been disturbed. Sixth MCQ is phosphorus is needed in our body to form and keep bones strong and cell membrane formation. The richest source of phosphorus with highest absorption in the gut is by taking which food? Whether canned beverages, rice, raw eggs, salads, or cereals.
D.
A.
Yes, A. Alpha is the correct option. Canned beverages. The richest sources along with the highest absorption is by the canned beverages and bottled beverages and other baking items. A construction worker is having vomiting and diarrhea for the 2 days in summer season. He also started having lethargy, headache, seizures, and coma. It may be due to deficiency of which nutrient? Whether calcium, phosphorus, sodium, potassium, sodium, magnesium, or selenium.
D. Sodium.
Yes, sodium is the correct option. As his sodium has been lost during vomiting and diarrhea, and also during the hot summer season, he started having the symptoms of hyponatremia. So, sodium is the correct option. Eighth MCQ is a person after recovering from acute diarrhea has constipation, fatigue, muscle weakness, and cramps. His labs show potassium deficiency. It can be managed by advising which food, whether apple, banana, mango, watermelon, or melon.
Beta. B. Banana.
Banana.
Beta, banana is the correct option as it is the richest source of potassium. Ninth MCQ is parathyroid hormone acts on bones to decrease serum phosphate level. What will be its effect on kidney regarding phosphate metabolism? Whether increases the serum phosphate level, increase urine excretion of phosphate, decrease serum phosphate level, decrease urine excretion of phosphate, or no effect on kidneys.
D.
B, yes, B, increase urine excretion of phosphate. 10th MCQ is for preventing chronic disease risk reduction. The daily intake of sodium should not exceed which amount for men and women for the ages of 14 years of age and older, whether 1300 mg daily, 2300 milligrams per daily, 3300 milligrams daily, or 4200 milligrams daily, or 5300 milligrams daily.
C.
B, 2300 milligrams daily is the is necessary for chronic disease risk reduction. This is the key of my MCQs, and thank you very much.
Thank you very much, Dr. Awais. Very nice presentation and very well organized, and you have timely done it. The most important part is that you have talked about calcium and how different phylates and other things, especially in plants like spinach, are decreasing its bioavailability. And this is the most important point that why calcium is not available to many people because they are not drinking milk and other calcium resources. And the other thing is that the dietary habits are usually such that the milk and different type of phylates, they are combined together. And we have seen the very good example is tea. Again, there is very difficult for the body to make that calcium available that is present in milk if it is used in the form of tea. Another important point is that you have talked about magnesium and how the magnesium machine you have presented. That is again a very good idea to present it. Thank you very much. Very well done. So we will stop here and see you next time. Allah Hafiz.
Thank you very much. Allah Hafiz.